Great, so welcome back to our channel. My name is Dhalia Masud. I'm a plastic and reconstructive surgeon, and today we have the pleasure and honour of having Miss Shikha Gupta, who's a plastic and reconstruction surgeon from India. She currently works in Amrita Hospital in New Delhi, and it's a real privilege to have her here today. So thank you and welcome.
Thank you very much for having me here today.
Great. So today we're going to be talking about breast reconstruction and seeing what the differences are between India and other countries. Everything is, you've got great surgeons now there. You were trained here and in India, and you learned a lot about reconstruction and microsurgery here, and you're taking your skills back to India in this really amazing hospital with some amazing surgeons there. But we found some discrepancy in reconstruction. So just comparing India and the UK, in India, you have around 192,000 diagnoses of breast cancer, and at least 2/3 of these require full mastectomy. However, there is only less than 1% of these women, who are largely young, that have reconstruction. Now, that compares to England, where we have around 56,000, and we will have 1/3 of these will go through reconstruction when they have a mastectomy, either an immediate or delayed phase. That's quite a discrepancy, don't you think? Why do you think that is?
So, as you rightly mentioned, the figures are alarming. Breast cancer is the most common cancer in India. However, as you rightly mentioned, the reconstruction rate is less than 1%, which is very sad. So there was a big survey conducted in India in which it was found that only 48% of women in India were aware of breast reconstruction. And when they were made aware, almost 75% of them wanted reconstruction. So there's a big gap between the awareness and the action. And somehow I feel that the system around is preventing women from having breast reconstruction done. So the first and the foremost reason, which I feel, is the lack of awareness. There are a lot of misconceptions, myths that breast reconstruction delays cancer treatment. It is a cosmetic procedure. And there's a stigma about discussing about body image, cultural beliefs, and the whole family, not just the woman herself, is involved in making decision about breast reconstruction. And the family members feel that it is not necessary. The second reason is the financial constraints. So lack of breast reconstruction coverage in government-led schemes, and a lot of private companies support cancer treatment. Private insurance companies, they support cancer treatment, but they may not support breast reconstruction. And an average cost of breast reconstruction in India will be around $3,500.
How much, sorry?
And around $3,500,
Okay.
$3,500 to $4,000. So it is an extra burden, financial burden for the family to undergo breast reconstruction. The lack of support group, not enough support group, and in rural India, especially in rural India, there's still a lot. The rural hospitals still lack qualified, trained plastic surgeons who can offer breast reconstruction to women.
Okay. There's so many. That's really good information that you've just told us there. So in terms of, you're saying around 45% of people don't know, or they do know about breast reconstruction?
They do know about breast reconstruction.
So 45%, if you've got breast cancer, 45% of those people will become aware that reconstruction is available.
Yeah.
Around 75% of ladies after their mastectomy actually want reconstruction, but we know that less than 1% end up having a reconstruction.
So it's basically, as the various factors I mentioned, lack of awareness, misconceptions and myths about breast reconstruction, that it is not a necessary procedure. They don't consider it as a past off cancer treatment, which is like optional and may or may not be needed. then it delays cancer treatment, and there is a lot of stigma about discussing about body image, and
So,
a lot of
what is it about the body image and the family members? I can understand. So, you said that it cost $3,500 for to have a reconstruction, and I can understand that's a huge amount. We're really, really lucky in the NHS in that it's it's an NHS service. It's free for them, so we don't have to think about it. So that's another reason why more ladies go for reconstruction. I don't know if it would go down if they ended up having to pay, but 3,500 is a massive burden. But let's say those part of the population that can afford it, what's the body image that's stopping them from having the reconstruction? What do you think is
so they don't lay emphasis on the body image, and the entire family is involved in decision making about breast reconstruction, and they may deem it unnecessary.
Okay, so they deem it unnecessary. So they don't basically understand the psychological and functional benefits
They don't
of,
understand that it can improve psychological, emotional, and physical well-being of the lady.
yeah. And they are a very young group. So what happens to these young group of ladies that have a mastectomy and they don't have any reconstruction? Do you know much about what happens, how they live?
Yeah, obviously there is lack of self-confidence, less quality of life is not very good, and they have this inherent stigma about their body image, that they don't feel a sense of completeness, which a lady who has had breast reconstruction would feel. She would be more confident, would be more stable psychologically and emotionally. However, a woman who has not had breast reconstruction will be emotionally labile, and obviously will have lots of psychological issues.
Yeah, I can understand that, particularly when they're so young. I think your peak age in India is well into, I think, what's the peak age in India for having breast cancer? Is it 40s?
Yeah.
Peak incident is 40 to 49, and so peak incident is 40. Peak incident breast cancer is between 40 to 49 and 20 to 25% under 40. Whereas in the UK, our peak age is around 65 to 70. So there is a significantly older group and they're all having reconstruction, and you've got a significantly younger group and they're not having a reconstruction. So we both know that there is a significant psychological and functional impairment. Yeah.
And I feel that breast reconstruction is not a vanity, it's a basic right. And we should aim to make it make it part and parcel of cancer treatment rather than just as an option.
Absolutely. I totally agree with you. It should be an inherent part of breast cancer resection. So, what do you think that we can do to help improve awareness of breast cancer and the reconstruction?
Yeah, so there was a big survey conducted in India, and the women were asked that how could we increase the awareness about breast reconstruction, and most of the women felt that breast reconstruction awareness could be done through social media platforms like Instagram or Facebook, then formation of social support groups, because they are the ladies who've had breast reconstruction will help break the myths and inspire other women to undergo breast reconstruction. So that's the need of the hour. The women who've had breast reconstruction should take the lead, and they should inspire the ladies who've been diagnosed with breast cancer and wanting and going through the process of treatment of breast cancer. Then the other thing is that making breast cancer reconstruction a part and parcel of the government-led health scheme, and the private insurance companies should also make cancer uh, post mastectomy reconstruction as a part of the cancer treatment. So the cancer treatment should not just stop at the resection; it should continue further.
So,
Then
is it
taking on
available? Do you have an NHS system in India or a form of NHS system?
so there are government hospitals in India as well, but
Do they do
but there are
reconstruction in the? Do they?
Yeah, there are hospitals which are doing reconstruction. I'm not saying it's bad, like it's improving. Definitely, the awareness is increasing, and but it needs to be far more than what it is at the moment.
Okay. And in terms of insurance, is it available on the insurance in India?
So the insurance coverage is still very low in India because the paid insurance, so it is still very low. The people who have to pay cash, they have to pay out of their pockets to have the cancer treatment done or to have reconstruction done. So I think that's a major hindrance because the ladies, like I have personally encountered ladies who are covered under health insurance schemes, they would want reconstruction. And a lot of like ladies who are working in multinational companies who have corporate insurance schemes in place, it would definitely undergo breast reconstruction. However, like ladies from families who are paying cash or who are paying out of their pockets for treatment, there are a lot of factors which impact whether they would undergo reconstruction or not.
Okay. So one of the things that you said is that they're put off by the surgery. What can you say? I mean, we both do surgery, we both do the reconstruction. In India, I'm sure the setup is slightly different. What can you say about to future patients who are thinking about reconstruction, about the recovery period and how it can affect them physically and long term?
Yeah, so that's a big thing because the moment you tell the patients that it's a 6 to 8 hours long operation with a longer hospital stay as compared to just mastectomy. So there are a lot of patients who are put off by that, especially their families. But I normally
You've
tell
got
my
to
patients that
remember that's 6 to 8 hours, including the mastectomy. So it's not on top of the
yes,
mastectomy.
yes,
Yeah, yeah,
yes.
yeah.
6 to 8 hours, including the mastectomy. So I always tell my patients who see me for who want to who come to take advice for breast reconstruction that it's absolutely a safe procedure. It is a 6 to 8 hours operation, but it is it can be done and it will improve the psychological and social well-being. So it will improve their self-confidence. It will improve their quality of life, and once it's done, it's it's done. Like they don't need to worry about anything else in future. And the major thing is that the myth, breaking the myth that it hampers with the cancer treatment.
Mm. So, what we're basically focusing on in your discussion is using your own tissue, the DIEP reconstruction. Um, Obviously, every surgery has risks, you know,
Yes,
and it's important to understand those risks. But the benefits, I feel, for a lot of ladies outweigh those risks. So, for
yes, absolutely.
your in the UK, I found the best area that we take fat from is the tummy because that's the most available one
Yeah,
in our UK ladies. That's that's their figure, and they have risks. And the most common complication or the most common issue is pain in the tummy, which can last a few weeks and sometimes a few months, and bloating. And I find that once you've got over that, the benefits of having a breast, most ladies, 90% of ladies, are happy with it. In the DIEPs that you've done, have you found any difference? Is the tummy still the most common option, and what risks do you deal with?
yeah, absolutely. The tummy is the most common complaint. A lot of ladies complain about. So tummy is the most common option for breast reconstruction. Indian ladies also have a juicy abdomen, and it is very easy to take it from the abdomen. And I think it's a wonderful donor site, and with an added advantage of having a tummy tuck done at the same time. And the other thing is that, as you rightly mentioned, that um, tummy, they always complain of pain. The most common complaint of ladies who undergo reconstruction using their own tissue, that is abdominal tissue, they always complain of bloating, pain in the abdomen, which obviously lasts for a few weeks to some months. eventually it does settle down. So whatever DIEPs we are doing here, the most common complaint is related to the abdomen.
Absolutely. But we both feel that in the right patient, it's a risk worth taking because of the
Yes,
benefits of
absolutely.
the psychological benefits of the breast. So what issues have you found functionally in India with the heat and the clothing when they wear a prosthesis and when they don't have, or if they don't wear a prosthesis? So for patients, not necessarily psychological, we know psychologically they are affected, but what are the physical issues that you found with patients that just have a flat chest?
Yeah, so the ladies who have flat chest, they normally would wear prostheses. First of all, Indian clothing consists of wearing a blouse or a top or a salwar kameez. And when they wear that, obviously one side is flat and the other side is having the normal breast. So they're unable to interact and they shy away from going out in social gatherings and festivals. The other thing is that when they wear prostheses, because the hot weather, it causes a lot of rash and um, discomfort in the area, especially if they had radiotherapy. That exacerbates the whole thing. So I feel that wearing a prosthesis is not a good option, especially in the hot weather conditions, the kind of hot weather conditions we have in our country.
Okay. And I think that's really important, having to wake up and then not just being able to put your bra and clothes on. You have to think about putting the prosthesis in and then your bra, and then I'm sure you have to wear a chemise and the blouse and all these things on top, and it's boiling, sweltering hot. And you're quite self-conscious, so all these things can obviously affect, yeah, particularly, I mean, it can affect anyone, but if you're young and you want to find a partner, it's difficult. What if people are unmarried, what is it like for these ladies that are unmarried and they don't have a breast? Because you have such a young group of people that require mastectomy.
I feel that the ladies who are unmarried, lot of them do go for breast reconstruction. In from my experience, from with the ladies whom I have interacted with, and those who are awaiting cancer treatment or those who are awaiting mastectomy
Mm.
and wanting to have reconstruction done. A lot of young ladies who are unmarried would definitely go for a reconstruction, and especially in plant-based reconstruction, where they don't want to expend their abdominal tissue, considering that they would want to consider pregnancy in future. So I think that the uptake is quite good in ladies who are unmarried.
Okay. And what can we do to? So you want to raise awareness. What for patients that? And so you hopefully you will get some patients that have had the reconstruction and get them to tell their journey. Is there anything else that the government can do to make sure that patients are given all the information when it comes to breast cancer and reconstruction?
Yeah, I think through social media, television, radio, and newspapers. So these are common modes of communication, and I think once we communicate to the women in their regional languages, rather than just focusing on a subset of women in the city, the message needs to go everywhere, and that can be done only through social media. And the government should have like social workers who can
Mm.
go to every nook and corner of the country, a lot of NGOs who can help with bearing expenses of breast reconstruction. And the government should incorporate breast reconstruction in the various health schemes.
Mm. And that's really interesting when you said you need to go to every corner. So, is there a difference between patients in rural areas and patients in suburbs when it comes to
Yes,
reconstruction?
of course, because yeah, the mindset is completely different because the women in rural India, they don't have enough power to make decisions for themselves.
Mm.
The thing that I was telling you, that the entire family is involved in making decision, that that holds very true for women in rural India.
So it's not
And
the
plus the
woman
lack,
making the decision, it's the family making the decision for them.
yes,
Hmm.
yes, and also lack of adequate health facilities in rural India. So they would have a general surgeon, but they might not have a plastic surgeon who's qualified or trained enough to perform microsurgery.
Okay, that's really interesting. But
So
in the suburbs, it's slightly different. You've got
yes,
more in, yeah. And are plastic surgeons in India trained to do microsurgery? And will they be able to deal
yeah,
with the
microsurgery.
cases? Yeah.
Yes, so yeah, so microsurgery is coming up in a big way in India. Like there's a microsurgery boom. Every center wants to is performing microsurgery. We're doing like good lymphedema work and good uh, reconstructive work. So I think microsurgery in big cities and in tier one, two, three cities is being done regularly now.
Okay, fine. And it's not just breast reconstruction, is it? Microsurgery can be done in head and neck, lower limb, trauma,
Yes,
all the, so the benefits of having microsurgery in each hospital will be massive. Yeah. Every surgery has risks, but you need
yeah,
to weigh up the risks and benefit ratio. If the benefit is far greater, you're going to have a breast for life. You're going to be able to wear clothes. Psychological and functional completeness far outweighs the risks of that we've mentioned associated with the DIEP. So I think it is important to be transparent, which is what you do.
So I just want to relay this message to all the women out there that breast reconstruction is a right of every woman. It's a fundamental right of every woman, and they should consider it as a part of cancer treatment. And once it is conveyed in that manner to the patient, the the acceptance for having reconstruction, that will be very high. And the other thing is that what I want to convey is that it doesn't hamper cancer treatment, a safe procedure to go through, and um, we should just fight for women to have breast reconstruction done.
Well, thank you very much for your time. It's given me a really good insight in reconstruction and how people approach things in India. I would love to come, but have not invited me yet. One day, when you invite me,
You're invited anytime.
I will come to India. Now,
Oh, yes.
so I heard that you are organizing a very important international meeting. Could you tell me a little bit more about that?
Oh, yeah. So we are organizing the annual conference of the Breast Reconstructive and Aesthetic Surgeons Association of India in October. So it's going to be a wonderful conference covering all aspects of uh, breast reconstruction as well as aesthetic breast surgery. And we'll have really good international faculty, international and national faculty both, to go through various aspects of breast reconstruction and also management of lymphedema as well. So I think I would like to personally invite everyone to attend this conference. It's going to be a great educational extravaganza.
Great. I'm so looking forward to it. I'm waiting for my invite, but yeah, I am, and I've got the whole team from Norfolk and Norwich Hospital keen to come along to see you and meet
Wow,
you.
that's lovely.
So yeah, we've got a group of us that are going to come. And
Great.
that's it. Well, thank you so much for your time, and hopefully we'll see more of you in our future
Thank
podcasts,
you.
and we can discuss a little bit more about the physical aspects of recovery in India as well. All right.
Yes, it's
Bye.
a pleasure interacting with you. Thank you. Bye.